Welcome to The Healthline, issues that shape our well-being. I am your host, Dr. Andrea Alt-Brutus. In The Healthline, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. In today's episode, and in honor of Breast Cancer Awareness Month, we welcome Angela Papalia, Assistant Director of the Adelphi New York Statewide Breast Cancer Hotline and Support Program, and Patty Bunyan, a volunteer with the program. Angela and Patty will tell us more about the Adelphi New York State Breast Cancer Hotline and Support Program and the work that you do there. So Angela and Patty, welcome to the Healthline.
Thank you.
Thank you.
So Angela, I'd like to start with you. Can you tell us more about your organization and the work that you do there?
Absolutely. Thank you so much, Andrea. The Adelphi New York State Breast Cancer Hotline is the oldest breast cancer hotline in the country. We have been providing free professional counseling support services to residents of New York State for over 45 years. It's an honor to serve everyone who has been touched by breast cancer by providing free access to educational services, support groups, licensed social work services in both in English and in Spanish, and providing an opportunity to educate the public about how they can empower themselves to receive free and low-cost mammograms regardless of where someone lives. And we're here to help every single step of the way for individuals that have been touched by breast cancer. For those who are diagnosed, we're able to provide an amazing hotline that's staffed by over 65 trained, professionally supervised volunteers, all of whom are breast cancer survivors themselves and who truly understand what it's like to hear those life-changing words, "You have breast cancer."
And so I know that you have the hotline and the counseling support program. Can you tell us more about those two particular aspects of your organization and the services you provide?
Our hotline is available 7 days a week, 365 days a year. From 9 a.m. to 9 p.m., people can call from wherever they are, accessing free services and to have an opportunity to talk to somebody who's been there. People simply have to dial 1-800-877-8077 to reach a trained volunteer who is a breast cancer survivor and who can truly understand what that person is going through. We've also have a text line to make it more accessible to people, and they can reach us simply by texting 516-262-3263. And those text messages are answered every single day, 365 days a year, from 9 a.m. till 5 p.m. Our peer-to-peer program is an opportunity for callers to be matched up with someone who's going through exactly what they're experiencing. So, for example, if someone is newly diagnosed and they're struggling between making a decision about breast surgery, exploring treatment options, and really just need someone to listen to what's going on with them, that's the perfect opportunity to utilize our peer-to-peer program.
Okay, great. And you can tell us more about the counseling and support program that you have?
Our bilingual social work staff is available to help provide free counseling, and that could be one-on-one in English language or Spanish language by our licensed social workers who are seasoned and are able to address the very specific and intimate needs of individuals who are going through a breast cancer diagnosis. Our counseling is absolutely free of charge, and our social workers are able to address the unique needs of every single person who is dealing with this life-changing diagnosis. Our comprehensive support groups are inclusive of those for newly diagnosed patients, both male and female, for those who are dealing with a metastatic or advanced diagnosis of breast cancer, We have groups for people who speak Spanish. Our Cafecito is designed to be available for people who speak Spanish as a primary language. And we also have a hormone therapy group for those who are going through that different stage of their journey with breast cancer. Our program is really proud to address the needs of the community. So we've found over the years that if we have certain referrals for patients who are, let's say, young women diagnosed under the age of 45, we're able to develop a group. During the pandemic, one of our amazing staff members created a curriculum that is inclusive of creative arts, and it incorporates using the creative arts to cope with a breast cancer diagnosis. And that program is offered twice a year. Once a year, it's a 4-week series over Zoom, and we also offer it one day a year in in-person forum where patients can come and just immerse themselves in creative arts and just enjoy a peaceful morning at the university to really embrace being there with other survivors. So we're really proud of that ability to look at the needs of the community and develop specific programs.
Nice. In terms of the counseling and support programs that you offer, is it time limited? If someone needs more extensive therapy, do you normally keep them in your program or do they transfer to outside resources? How does that work?
Our programs include both in-person support groups and virtual support groups. They're held over a HIPAA-compliant tier of Zoom. And typically when someone calls the hotline or calls our offices seeking counseling services, they're matched up with either a volunteer and then ultimately with a social worker who will help the individual learn which the best type of service to suit their needs. We provide short-term counseling, but because we are a not-for-profit, we have the ability to extend the quote-unquote short-term because we want to make sure that no one goes through a diagnosis alone. And then in turn, during that relationship, it's determined if that person would benefit from individual enhanced services. So we certainly refer out and we utilize all of our community partners across the state, inclusive of teaching hospitals and other licensed professionals, to really provide the most comprehensive support to the individuals that we serve.
Sounds great. Let's bring Patty into the conversation. So Patty, can you tell us more about the work that you do with the Breast Cancer Helpline and Support Program?
Sure, Andrea, and thank you for having me as a volunteer. I love this program, so I enjoy it so much. What I do is I volunteer on the hotline. We have a shift that we cover. As a survivor, it's, as all the hotline volunteers are, I can help offer the caller support and connect with them to help them with whatever questions they have or just to listen to them because they've just been told something. Most of them, when they call, they've just found out they've been diagnosed. And it's upsetting, of course. So to talk to somebody who's been through it, that's what I love. And then also we volunteer doing events, like say a library. You have a table outside the library and you have all the brochures and people stop by and you can tell them, what we offer and especially the 800 number, that's important. But the support groups and all of that. And if it's not for them, they can pass it on to somebody else. So I enjoy doing all those events and being face-to-face. That's what's nice, too, when it's an event, that you can speak to people face-to-face and you're a real person.
Great. And what motivated you to start volunteering for this organization?
Well, back on 1998, my sister was diagnosed, and it just shocked us. She was only 48, and we didn't know what to do. So I immediately was trying to help her and figure things out. Somehow, I think I had seen it someplace anyway, the Adelphi hotline. So I called up, and I actually spoke to, explained to the volunteer that was on the line what we were going through. She told me all about different information and sent me, back then they sent a lot of pamphlets out and booklets. So I always had that information and it helped my sister and I, and then I was put on a mailing list with Adelphi. But little did I know that 7 years later I would be diagnosed. So I had all that information and it was very good to have that, and I had the contact with Adelphi, so I went to a lot of the workshops that they offered back then on campus and all these different events. I met so many of the women now who I still volunteer with. Right away, I couldn't volunteer at the time because of work, family, all that. So when I retired, that's when I was able to go back and volunteer.
Thank you for sharing, Patty.
Yes.
Angela, what motivated you to join the organization?
When I first learned about this amazing program, I had just relocated to New York, and when I saw the comprehensive services and the structure of the Adelphi Breast Cancer Program, I was really inspired because it had the perfect marriage of a professionally led organization coupled with peer-led support. Breast cancer is something that has touched my life in many different ways in my family, and to see these women and men selflessly donate their time to help others because they understand what it's like to be there in that moment when your world has changed and you're told that you have a breast cancer diagnosis. It was so empowering to me to have this group of professionals and survivors come together. And I very much wanted to be a part of it. And I originally came to the program back in 2003, 2004. You know, we always say once you're a part of the Adelphi family, always a part of the Adelphi family. Mm-hmm. And it's really a privilege to work alongside of the incredible staff and volunteers that we have at the program, really touching and changing lives across the state, because ultimately we're all in this together and no one should have to face a diagnosis alone. And that's something that our program feels absolutely to be true. And we pride ourselves on being there for individuals and their loved ones during this very unimaginable time.
Yes. People often don't think about the link between breast cancer and mental health, but there's definitely a link. Can you tell us why these types of services and programs are needed and why it's important not to ignore that link between breast cancer and mental health? And we could start with you, Angela.
More than ever, it's important for people to know that they're not alone. And with the changing landscape of accessing medical services and mental health services, it can be very challenging. It can be very cost prohibitive when people are looking to seek help and they feel that they have no choice. It is paramount for individuals who are going through a breast cancer diagnosis, as well as their caregivers and their loved ones, to have that support. Mental health services is just as important as receiving medical care. It goes hand in hand. And to be able to offer professional, licensed counseling services free of charge to anyone who needs, that is really imperative to help people have a good outcome. And breast cancer is something that is life-changing and not only affects the person who's diagnosed, but everyone around them, everyone in their family system and in their circle. So it's really so critical that we are out there in the community and are educating people about accessing service and letting people know that it takes so much courage and strength to pick up the phone, to pass by that outreach table that you see in the community and say, where can I go? Who can I talk to? And we want people to know we're here. Mm-hmm. There's always somebody to talk to. There's always somewhere to turn, that you're not alone and you don't have to be afraid. You don't have to feel that this is a service that you can only access if you can pay for it, if you are in X, Y, and Z category. We are here for everyone.
And Patty, for you, why do you think this is important to look at that link between mental health and breast cancer from your own perspective?
Even though we always hear so much about the men and women that are diagnosed with breast cancer, when you hear those words, you feel like you're alone. You're the only one who has it. The hotline is man 9 to 9. You can call at 5 a.m. You can call at midnight, and somebody will call you back. Just having that, because sometimes those are the worst times that you feel all this and you're so alone. So that is just a blessing. And I feel blessed that I called that number many years ago and kept the connections because they're all amazing, from Angela and all the staff to all the volunteers I've met. It's just such a blessing, and it's to know that you're not alone. Yeah. We're out there to help you.
Yeah, there's a community there.
Oh,
that's
such a
waiting
community.
For you. Yes, great.
Yes.
So I know, we're now upon Breast Cancer Awareness Month. So what are some of the exciting, innovative programs and services you have going on this month for the month of October?
Every day we say is Breast Cancer Awareness Day for us at the program, but certainly we're really excited to kick off this October. We always have our signature event that's held at Adelphi University, and that's our celebration of survivorship. And this year it's going to be held on Thursday, October 16th. The doors open at 4 o'clock. Program begins at 4:30, and it's an opportunity for the public to come and listen to an inspiring panel of survivors and to hear their stories, what got them through, and what's brought them to this day. So we welcome everyone to join us on October 16th for that very special event, the celebration of survivorship. Certainly you'll be seeing us out and about in the community across Nassau and Suffolk counties and Queens. We have our bilingual outreach coordinator and our volunteers who are amazing and staff our outreach tables and speaking engagements across the community. So if you see our table, stop by, whether it's Breast Cancer Awareness Week at Adelphi University, at the campus rec office, whether it's your local library, you'll see a table with literature and information. It could be at your local church or faith-based institution. So we're really excited to be a part of many upcoming community events, really dedicated to help support people who are looking for services, the support. We're here. So we're just a call away.
Great. And we'll also have you here later on in October at Hofstra University for a community event that you're doing with the National Coalition of 100 Black Women. So you're all over the place, which is great. And I actually didn't realize you go out into Queens as well. This is part of a statewide program, so I'm guessing there's multiple hotline programs throughout New York State. You're just one of a few. Is that the case? Or
Well, we are the Adelphi New York statewide breast cancer program, and we partner with all different area hospitals, faith-based communities. We work with other community organizations. We go into schools. So we're always available to provide an in-person workshop, a speaking engagement. We provide a lot of programming over Zoom, virtual, to really allow us to work across the state. So it's really exciting. And people can simply call our offices to arrange for a speaker to come, either virtual or in person, and to talk more about the services that we offer across the state of New York.
That's amazing. Actually, I never realized that, even though it's in the title that you do service Syracuse or Buffalo or Albany. That's amazing. So before we wrap up today's episode, can you tell us more?
Take care of yourself. Make your health your priority. Get your yearly mammograms. If cost is a concern, the program has resources for free and low-cost mammographies. Because so many of us take care of others first, we have to put ourselves first so that we can take care of others. Just like when you're in the airplane and they say the oxygen mask goes on you first. That's what you have to do. Take care of yourself. You're worth it. And then you can take care of others.
Definitely great advice. And Angela?
Well, I couldn't agree more with Patty, and I would say to anyone that's out there that's really looking for someone to support them, we're here. You can do it. Make the call. You're not alone. And it takes so much courage to reach out for help, as we all know. But there will be someone there when you're ready to talk, when you're ready to seek out help, whether it's getting that free or low-cost mammogram that is so important, whether it's trying to seek out someone to help you navigate whatever challenge you're going through with respect to your new diagnosis or your treatment plan, whatever stage you're in, please know that we're here. You're not alone. Our hotline can be reached from anywhere at 1-800-877-8077.
Thank you so much. Thank you to Angela and Patty for joining us today on the Healthline podcast. Thank you for just taking the time and just all the amazing work that you do in the community. So thank you so much for sharing this information with our listeners. We really appreciate it. So this wraps up another episode of the Healthline, Issues That Shape Our Well-Being. I would like to thank our studio engineer, John Mullen, and I also would like to thank WRHU Radio Hofstra for their help with the production of this podcast. Lastly, I would like to thank Hofstra's School of Health Sciences for sponsoring this podcast. I am Dr. Andrea Alt-Brutus, and thank you for listening. Have a great day.